Did you know that one of the most common bleeding disorders can be spotted by a single lab clue? A prolonged PTT with a normal PT. This pattern shows up again and again on ASCP exams, and more importantly, it shows up in real patients. In this video, we're breaking down one of the most high-yield lab patterns in coagulation testing. Not just what the right answer is, but why it matters, how it affects real people, and what physicians do with that knowledge. Let's dive in. Here's a multiple-choice question, just like you'll see on the exam. A 10-year-old boy presents with joint swelling and a history of frequent nosebleeds. His PT is normal, but his PTT is prolonged. Which of the following factor deficiencies is most likely? A. Factor VII. B. Factor VIII. C. Factor X. D. Factor II. Take a second to think, then we'll break it down. Let's talk about what PT and PTT actually test. PT, prothrombin time, checks the extrinsic and common clotting pathways. APTT, activated partial thromboplastin time, checks the intrinsic and common pathways. So if PT is normal, the extrinsic pathway is probably working fine. That means Factor VII is likely not deficient, so we can cross out answer A. Now let's look at the common pathway. It includes factors 10, 5, 2, also known as prothrombin, and 1, which is fibrinogen. A deficiency in any of those factors would usually prolong both PT and APTT. Our patient only has a prolonged APTT, so we can eliminate answers C and D, factor 10 and factor 2. That leaves us with factor VIII. Let's take a closer look at why that makes sense. Factor VIII is part of the intrinsic pathway. It works closely with factor IX to activate factor X and continue the clotting cascade. If factor VIII is missing, the intrinsic pathway gets disrupted, and that prolongs the PTT. But because factor VIII isn't part of the extrinsic pathway, the PT stays normal. That's exactly what's happening in this case. These lab results point directly to a factor VIII deficiency, and there's a name for that condition: hemophilia A. Hemophilia A is one of the most well-known inherited bleeding disorders. It's X-linked recessive, which means it usually affects boys and is passed down by female carriers. Classic symptoms include bleeding into joints, easy bruising, and frequent nosebleeds. In this case, our 10-year-old patient has textbook symptoms: nosebleeds, joint swelling, and a prolonged PTT with a normal PT. That's a strong indicator of factor VIII deficiency. Diagnosing hemophilia A early lets physicians begin treatment and prevent long-term issues like chronic joint damage. Let's go over the clotting pathways one more time. Intrinsic pathway includes factors 12, 11, 9, and 8. Extrinsic pathway includes just one factor, factor VII. Thunk common pathway includes factors 10, 5, 2, also called prothrombin, and 1, or fibrinogen. PT tests the extrinsic and common pathways. PTT tests the intrinsic and common pathways. So when PT is normal and PTT is prolonged, the problem lies in the intrinsic pathway. On the exam, that almost always means a deficiency in factor VIII. Let's recap the big takeaways. Normal PT and prolonged PTT? That's a sign of an intrinsic pathway defect. Have out that most common cause? Factor VIII deficiency. Diagnosis: hemophilia A. If you understand that one lab pattern, you're ready for a common ASCP exam question and for recognizing a real-world bleeding disorder.